Hello everyone, this is Dr. Shivangi Tiwari and today we will discuss role of elastography in infertility. So, आज के टॉपिक में हम डिस्कस करेंगे व्हाट इज elastography, what are the types of elastography, its step by step instructions how to do that, what are its application in female infertility, its application in male infertility, its clinical applications, its advantages, what are the limitations, what can be the future directions, conclusions and differences. So, what is elastography? Elastography is a non-invasive technique of imaging the stiffness or elasticity of tissues by measuring the movement or transformation of tissue in response to a small applied pressure. So, when we are doing scan, then we can tell whether we can say like it is appearing as cystic, it is appearing as hard tissue, but nothing can compare the actual palpation. जो हम एक्चुअली पाल्पेट करके बता सकते हैं ना कि ये सॉफ्ट है, ये हार्ड अपियर हो रहा है, वो हम अल्ट्रासाउंड से नहीं बता सकते. तो हियर कम्स द रोल ऑफ elastography. Elastography is like a virtual palpation. The basis of elastography is only that it is analogous to the manual palpation. So white matters in infertility, मतलब ठीक है कैंसर में समझ में आता है, जिस फाइब्रोसिस है उसमें समझ में आता है कि यार ठीक है कैंसर है कि नहीं हमें जल्दी पता चल जाएगा, हार्ट टिश्यू है इसमें. बट white matters in infertility. See, transvaginal ultrasound and Doppler imaging, they are the primary procedures for assessing the ovarian and endometrial morphology. But the problem is they give only limited quantitative data on tissue biomechanical properties. So, the discovery of elastography has opened up new possibilities in reproductive medicine by providing a more thorough and objective assessment of the reproductive tissues. What is the principle of elastography? Basic principle of elastography is when we are compressing the tissues, the softer tissues that deform more easily as compared to the harder part. See, this picture it is showing when we compress a softer tissue, obviously it is going to deform more easily as compared to the hard tissue. So, coming to what is the physics behind elastography? So, there are some terms that we should know that this means this, like stress. बचपन से फिजिक्स में पढ़ते आ रहे हैं. What is stress? It is defined as force per unit area. Its unit is Pascal. Stress जो है it can be due to compression force. This compression force which act perpendicular to the surface and it causes the shortening of the object. While shear force जो होती है it acts parallel to the surface and it causes a deformation of the surface. Now, what is strain? When any tissue is subjected to stress, it tends to undergo deformation of its original size and shape, and the amount of deformation that it underwent is known as stress. Its unit is it is expressed as change in length per unit length of the object. What is elasticity? It is the property of the materials to return back to its original form after stress is removed. Now, tissue stiffness or elasticity, it is expressed by Young modulus, which is a ratio of stress by strain. So, what is stress? It is the compression pressure, and what is strain? It is the resulting deformation that has occurred. So, Young modulus is stress upon strain, where stress is expressed in Newton, while strain is expressed in meter square. So, hard tissues को deform होने, hard tissues जो होते हैं, they have a higher Young modulus as compared to the soft ones, right? Now, coming to the what are the types of ultrasound elastography techniques. So, based on the mechanism of applying the external mechanical excitation, there are two types. They can be quasi-static, also known as strain elastography, and they can be dynamic, also known as shear wave elastography. So, one by one we will discuss. What is strain elastography? Strain elastography is also known as static or quasi-static. How we have to do this strain elastography is, firstly we need an operator. Operator इसमें क्या है, strain elastography में जो operator है उसको force apply करना होता है. तो the operator applies a compression force via the transducer. ये जो उसने compression force apply किया, this induces a deformation. This induces strain waves of deformation that is parallel to the force. But the Biggest problem with this strain elastography comes here, that the operator has no control over how much tissue is compressed by the ultrasonic transducer. तो उसके प्रेस करने से, ऑपरेटर के प्रेस करने से कितना टिश्यू कंप्रेस हो गया, दैट हम मेजर नहीं कर सकते. Second thing is what we require is an ultrasound system that acquires the pre-compression data and non-compression data to depict the relative tissue displacement. कि कितना deformation हुआ है. So results is, if it is a soft tissue, then obviously it is going to have a more displacement, while if it is a stiff tissue or inelastic tissue, that is going to have a less displacement. This is the basic physical principle of strain elastography. See, before compression हमने ट्रांसड्यूसर रखा हुआ है. बिफोर कंप्रेशन इधर हमें पता है इतना पार्ट सॉफ्ट है, ये पार्ट हार्ड है, ये सॉफ्ट है. जैसे ही ऑपरेटर ने थोड़ा सा फोर्स लगाया तो क्या होगा, ये जो सॉफ्ट टिश्यूज है ये डिफॉर्म हो जाएंगे, जबकि जो हार्ड टिश्यू है उसको डिफॉर्म होने में मतलब ज्यादा फोर्स लगती है, तो हार्ड टिश्यू इतने इजीली डिफॉर्म नहीं होते. तो ये जो डिफॉर्मेशन हुआ, इससे हमारा वो रिजल्ट निकाल के देता है कि ये हार्ड टिश्यू है, ये सॉफ्ट टिश्यू है. तो वो कलर कोडेड फॉर्म में इलास्टोग्राम करके एक पिक्चर आती है स्कैन पे, जिसको देख के हम डिपेक्ट कर सकते हैं कि कौन सा हार्ड टिश्यू है, कौन सा सॉफ्ट टिश्यू है. लाइक दिस पिक्चर, जैसे कि ये है, बीच वाला पार्ट हार्ड था तो ये ब्लू दिख रहा है, उसके जो ऊपर वाला पार्ट था, नीचे वाला पार्ट था, वो सॉफ्ट है, तो सॉफ्ट रेड दिखता है, तो ये रेड आ रहा है, बीच वाला ग्रीन आ रहा है. सो इंटरप्रेट कैसे करना है? फर्स्ट इज ग्रे स्केल. जो नॉर्मल हम स्कैन करते हैं उस पर डार्क मतलब स्टिफ, दैट इज इट कैन बी अ सॉलिड और मैलिग्नेंट, एंड ब्राइट मींस सॉफ्ट, दैट इट कैन बी अ सॉफ्ट और सिस्टिक मास. जब हम कलर एनकोडिंग करते हैं तो ब्लू मींस स्टिफ एंड रेड और ग्रीन मींस सॉफ्ट. Next is the shear wave elastography. Shear wave elastography is also known as dynamic elastography. What is its technique? First is dynamic force. That dynamic force is applied by a strong focused ultrasound pulse or a set of vibrations by a specific device. So अल्ट्रासाउंड प्रोब में ही कुछ स्पेसिफिक सेट ऑफ वाइब्रेशंस वो प्रोड्यूस करती है, एक डिवाइस होती है जो प्रोड्यूस करती है. तो वो कितना रेट से किस स्पीड से वेव्स जा रही हैं वो सब कैलकुलेट कर सकती है. तो दैट्स व्हाई shear wave elastography is a quantitative one, while जो strain elastography है that is a qualitative one. तो जो उसने फोर्स लगाया, this induces shear waves which are perpendicular in direction and they are slower in velocity to the dynamic force, and the speed of the shear waves is proportional to the elasticity in the tissue. Second thing is the ultrasound system. Ultrasound system tracks the shear waves via multiple sound pulses, obtaining quantitative estimates of the tissue stiffness, and color is used to image the response. So this is the basic physical principle of shear wave elastography. So in the first step, these shear waves are generated using the acoustic radiation force. Then these force they propagate perpendicularly to the primary ultrasound wave, but at a lower velocity. Then these in the step 2, these fast plane wave excitation is used to track the displacement. So how much displacement has occurred, kitna displacement hua, that is going to be calculated. So it is going to calculate the tissue displacement is calculated using a algorithm that is already saved in the ultrasound. Then in the third step, it estimates the shear modulus. It estimates the shear modulus because young modulus value we can know because we know how much deformation has occurred, what is the strain value, how much stress, how much force we have put. So it gives us the estimate of the shear modulus. We can calculate the velocity of the waves that is going through. So when we do the shear wave elastography in the soft tissue, so there is the slower propagation of these waves. There is a lower shear wave velocity, while in the stiff tissue there is a faster propagation of these waves, so there is a higher shear wave velocity there. And just like strain elastography, इसमें भी एक color coded elastogram आता है, and from that we can comprehend क्या report है. So how to interpret? In color elastogram, it gives two things, color elastogram and young modulus value. Color elastogram, if it is a uniform blue pattern, that means it is a benign lesion. If there is a spectrum of yellow to red, then it is most probably a malignant lesion or rigid areas. Then coming to the young modulus value, If it is young modulus value is between 20 to 80 kilopascal, then it's a benign lesion, and if it is above 100 kilopascal, then it is most probably a malignant one. So, comparing the types of elastography, strain elastography measures tissue deformation under manual or physiological compression. It is a qualitative or semi-quantitative one, and it is commonly used in cervix, prostate. While shear wave elastography uses focused ultrasound pulses to generate shear waves and measure their speed. They are quantitative. They give result in kilopascals or meter per second, and they are commonly used in endometrium and testis. Now, coming to the application of elastography in infertility. We can use it in cases of female infertility, for male infertility, and for the clinical application. So, coming to the female infertility applications. If we talk about uterus, the uterus mate can evaluate that whether the endometrium is receptive or not, because it is said that if the uterus is soft, it is linked to the better implantation rates. Next is it can measure the junctional zone, which is beneficial for identifying adenomyosis. Because sometimes what happens is when we are doing scan, we are not able to find where is the junctional zone. In such cases, this elastography can help us in detecting the junctional zone that is beneficial for identifying adenomyosis. It helps in the assessment of the treatment responses in uterine fibroids and adenomyosis. It helps in the earlier uterine cancer diagnosis. Next is cervix. In cervix, cervical stiffness can predict embryo transfer difficulty. It can help in the making of the risk prediction model for preterm delivery and for the earlier cervical cancer diagnosis. If we talk about ovary, it helps in the early detection of ovarian aging, earlier detection of premature ovarian insufficiency, for the diagnosis of PCOS, endometrioma, in the earlier diagnosis of the ovarian cancer. Now, as you can see in this picture, this is the picture of a shear wave elastography that is for the normal endometrium. So we can see in the A and B picture, this is in the proliferative. This is the proliferative endometrium, and this is the secretory endometrium, and a uniform blue area we can see. And if it is a uniform blue area in the shear wave elastography, then it's a normal endometrium. Then image C, this is further showing the region of interest. So like we can, if we have any doubt, we can select one region of interest, and there we can see. There also in the region of interest also, there is a uniform blue area. Next comes junctional zone. See, in the first picture, what we can see is this is a transvaginal grayscale ultrasound, and the junctional zone is not clear. It is appearing as a fuzzy region. And when we put shear wave elastography, we can clearly see and distinguish. We can clearly see the junctional zone and the surrounding healthy tissue. We can see this white mark, white arrow is showing the junctional zone. And with the help of shear wave elastography, this endometrium and the junctional zone we can clearly delineate by a shell function key, and the shear wave speed of both the regions we can obtain simultaneously. So it is helpful in the diagnosis of adenomyosis. Next, next is adenomyosis. See, this is the first picture. It is showing a retroverted uterus in which there is an interrupted junctional zone and echogenic cystic lesions, uterine wall asymmetry, fan-shaped shadowing that are suggestive of adenomyosis of the anterior wall. The adenomyosis, when we put the elastography, then adenomyosis is softer than the surrounding myometrium. So here is the adenomyosis, and it is appearing softer than the surrounding myometrium, and it is appearing ill-defined. If it is defined, the margins are defined, then it is a fibroid. But if the margins are ill-defined, then most probably it is adenomyosis. In focal adenomyosis, yes, the margins are well defined, but this is one of the point to differentiate. Then second picture is of a focal adenomyosis lesion. When we put the elastography, then the lesion appears as a softer area within the uterine wall in the harder surrounding myometrium. तो अगर हमें आसपास का myometrium it is appearing hard, but uterine wall में कुछ थोड़ा सा area हमको softer मिल रहा है, तो it is a case of a focal adenomyosis. See this C picture, it is showing an anterior ill-defined adenomyosis region which is presenting as a softer area but with a harder halo surrounding the cyst. Here is also a picture of adenomyosis. And fourth picture, it is showing a large adenomyosis and echogenic cyst we can see in the anterior wall of the uterus. Then this picture, it is showing uterine fibroid. So this is the mid-sagittal view of a fibroid. We can see there is a softer capsule that is present all around the fibroid. The echogenicity as well as the color map is somewhat heterogeneous. ये देखिए थोड़ा heterogeneous है, एकदम सेम नहीं है. It is like a little heterogeneous. थोड़ा ये अलग अलग सा दिख रहा है, बीच में ब्लू के साथ से थोड़ा ग्रीन भी दिख रहा है. This picture is of a mid-sagittal view of a Figo 1 fibroid. The contrast with the softer endometrium is clearly shown in the color map. तो हम clearly देख सकते हैं कि there is a contrast with the softer endometrium. Third picture, there is a focal softer area in the fibroid, and this is a very unusual case of a fibroid जिसमें बीच बीच में softer areas मिलते हैं. Now, it can help in differentiating the polyps and RPOC. अब यूट्राइन कैविटी के अंदर पॉलिप दिख रहा है, ये आरपीओसी है, कैसे डिफरेंशिएट कर देंगे? तो इट कैन हेल्प इन differentiating that, because the ultrasound elastography characteristics, they may facilitate the DD between RPOC and softer structures such as endometrial polyp or blood clot. So see, first picture, it is showing non-uniform homogeneous polyp with regular anechogenec cyst and bright edge. The endometrial polyp is endometrial polyp it shows softer with elastography. In this picture, we can see the loss of the elastography characteristics due to increased surrounding pressure after gel installation. Gel install किया तो जो उसकी जो elastography की जो characteristic थी वो loss हो गई. In the third picture, there is a transverse evaluation of the uterus. इसमें क्या हुआ? The midline is clearly interrupted. The elastogram indicates it's a softer tissue. In the deep, large polyp, which is softer than the myometrium, but it is harder than the endometrium. See, these two pictures, they are of RPOCs. So it's a transverse view of the इसमें RPOCs. We can see the sonographic image of RPOC. It may be similar to polyp, but the elastogram, it clearly shows a harder tissue. तो अगर हमें RPOC में और polyp में differentiate करना है, तो polyps usually they appear as soft, while RPOCs appear hard in the elastography, and by that we can differentiate. अगर यूट्राइन कैविटी में कोई foreign body like intrauterine device है, that also we can see with elastography. So this is a mid-sagittal view of uterus that is with and without the superimposed color map. The secretory endometrium is obviously softer than the surrounding myometrium. So this is the picture that is showing the harder intrauterine device in the softer endometrium that is surrounded by a hard myometrium, that we can clearly see. Next is, if we come to cervix, it helps in the prediction of embryo transfer ease. So हमें पहले ही पता चल जाएगा कि हम make out कर सकते हैं कि that case is going to be a easy embryo transfer or a difficult embryo transfer. और अगर difficult है तो should we proceed to any cervical dilatation or procedure, that also we can make the decision. So accurate prediction of the embryo transfer ease could allow the identification of those patients that should undergo cervical dilatation prior to the embryo transfer in order to improve their IVF outcome. And it is hypothesized that cervical histological changes in patients with cervical pathology could lead to difficult embryo transfer in an IVF setting. So this is picture, it is showing a cervical ultrasound elastography, and by identification of the cervical tissue dishomogeneity, we can make out whether it is going to be a easy embryo transfer or difficult. So it is showing 6 regions of interest that we can see in the cervix. See, this is the cervical canal, which is highlighted in the yellow, and the internal and the external uterine orifices we can see that are indicated with the symbols. This is cervical elastography. This is the cervical elastography in a normal case, right? So in here it is red, that means it is soft. Around that it is green, that is it is a little hard than the inside of the, and outside it is blue, that is hard. See, this picture, see, it is normal. So cervical channel appears red. Surrounding tissue that is comprehensive of the 6 region of interest appears uniformly green with rare blue spots. so embryo transfer resulted to be easy. In the second case, cervical canal is not uniformly defined, right? Only this part is there. Then the surrounding tissue shows a dishomogeneous color pattern. It resulted to be difficult. In the third case, cervical canal appears to be partially obstructed by a hyperechoic tissue in grayscale image, and the elastographic image demonstrates presence of a diffuse tissue dishomogeneity. So ETA was not successful, and with the transfer with that route, so they did transmyometrial embryo transfer in such case. This is the These are the pictures from this paper that is that is published on the evaluation of the cervix tissue homogeneity by ultrasound elastography in infertile women for the prediction of embryo transfer is a diagnostic accuracy study. Now, coming to the elastography in ovary, how we can use elastography in cases of in ovary is ovarian aging. As the patient ages, as there is an advanced reproductive age, ovaries fibrotic हो जाती है, तो में fibrosis we can make out hard tissue. ovary में कुछ part हमें hard दिखने लगेगा. Ovarian cancer may be malignant tissues, they appear stiffer than the healthy tissue. In POI cases, they are associated with ovarian fibrosis and accelerated reproductive aging. In ART, repeated ovarian stimulation during ART, it may increase inflammation in the ovary that can lead to increased fibrosis. In PCOS, PCOS is associated with hypertrichosis, increased accumulation of the fibrotic tissue within the ovary. Endometriomas, they also contain stiffer tissue than the other cysts in the ovary. So, first picture you see, this is of a reproductively young 31 years old female, and here you see जो young modulus है, its value is 16 kilopascal. And ये सारे pictures में ovarian stiffness measurement दिया गया है. So in a 31-year-old patient with 15 AFCs per ovary, it is showing it's a normal ovary. This picture is in a 41-year-old with only 2 antral follicles per ovary. So here you can see it is not uniformly blue. इसमें it is not uniformly blue. इसमें कुछ hard tissues भी हैं बीच में. And see, इसका stiffness measurement increase हो गया, 16 to 30 हो गया. Then this is the simple cyst. If it is a simple cyst, उसके आसपास का जो tissue होगा वो soft होगा, तो 2 kilopascal. इसमें hemorrhagic cyst में भी 3.4 kilopascal, तो मतलब soft tissue है. कि endometrioma में hard हो जाते हैं, fibrosis हो जाती है. तो see here value is 25 kilopascal. Next, coming to male infertility applications, we can use it in cases of testicular assessment because shear wave elastography evaluates tissue stiffness and the spermatogenic potential. It differentiates normal versus abnormal sperm profiles. It helps in varicocele diagnosis. It assesses testicular function and predicts the outcome, and it's a non-invasive alternative to biopsy. So this is a picture of a strain elastography. Color coded picture elastogram we can see, and this B mode image is the normal testis. So this is the normal testis, and the central parenchyma, it is green in color, and there is a blue edges that is known as a boundary effect, which is surrounded by the red band. Now we can evaluate the testicular stiffness. Higher testicular stiffness value, it is found in patients of varicocele. If there is a high testicular stiffness, that means there is a less spermatogenic potential, so it is more in the oligospermic patients than testis of the healthy controls. So this is a elastography of a 30-year-old normospermic male patient. This is a high resolution ultrasound. This is showing a shear wave ultrasound. This is a uniform blue thing that we can see, and so testicular stiffness value is 3.4 kilopascal. Then when there is a 43-year-old oligospermic patient with bilateral testicular varicocele, you can see that uniform pattern is gone. That uniform pattern is not there. Because why? Because it is destroyed, and this testicular stiffness value it is increased to 7.3 kilopascal and 8.6 kilopascal in the right and the left testicle respectively. Now, coming to the clinical applications, we can use to predict the IUI success because uterine stiffness measurement correlate with the success rate. So, जितना softer uterine tissue होगा, जितने uterine stiffness it is less, there's a high chances of implantation. Then next, we can use it in cases of IVF prediction. Elastography helps in assessing the endometrial receptivity and cervical pliability. same thing that I have discussed before. Endometrial receptivity is higher in cases of softer endometrium and in the softer cervix. Now, how we have to do it? We can do what we need for doing elastography. We need one ultrasound machine that has elastography capability, like there are GE Evolution, Philips, Epic, Siemens, Ecuson, these are there. Then we need one high frequency transducer, transvaginal for uterus, cervix, and a linear probe for testis. And we need obviously a trained operator with knowledge of reproductive anatomy. Evolution acid is like बहुत वाइडली यूज होता है. इसमें हम कैसे करते हैं दैट विल डिस्कस. सो इलास्टोग्राफी it primarily that evolution acid machine it primarily supports strain elastography. इसमें shear wave elastography नहीं है. Elastography software it is integrated in many OB-GYN presets and it is best used with transvaginal and the linear probes. So how we have to do it? Firstly, we have to start the exam. We have to select appropriate preset. अगर हम uterus या cervix को देख रहे हैं, then we have to select TB gynae or TB OB. For testis, we have to select either small parts or scrotum. We have to apply copious gel to the transducer and we have to position the patient. If we are doing for female transvaginal ultrasound, then lithotomy position. For male, if we are doing for the scrotal, then in the supine position with the scrotum supported with some towel. Then we have to activate the elastography. We have to press the elastography button that is there. Then we have to do the image optimization. Use B mode first. First we have to use the B mode to identify the target for a mid-sagittal uterus for the endometrium. If we are looking at the cervical canal, then from internal to external it should be there. Then both testis in the longitudinal and the transverse views. Then we have to adjust the gain, we have to adjust the depth, and we have to adjust the focus. Then we have to perform the strain elastography. Up strain elastography mein we have to put the manual pressure on ourselves. So we have to gently apply manual pressure by moving the probe slightly back and forth if we are doing TVS, or vertical tapping if we are doing it for scrotum with the linear probe. Then we have to watch the strain indicator bar on screen. If that strain indicator bar spring की तरह आता है, if it is coming green, that means it is optimal. Then a color-coded elastogram appears over the image. If it is coming red or green, that means it is a softer tissue. And if it is coming as a blue, then it is a harder or a stiffer tissue. Then फिर भी एक कोई particular region of interest है जिसमें हमें doubt है, then we can use that region of interest ROI. Use the track wall to place a box or ROI over the target like endometrial stripe or cervix. It's optional. Place a second ROI in a reference tissue to calculate strain ratio. Okay, strain ratio is normal or not. Then we have to capture and measure. We have to freeze the image when compression is optimal, like green bar is coming. Then we have to press measure elastography and strain ratio if it is needed. Then we have to say images or clips. Now, how to interpret the results? As I have discussed earlier, if endometrium, if it is appearing soft, if elastogram it is showing red or green, that means it is soft. Soft endometrium means it is normal or receptive. If it is appearing stiff, that means fibrosis or Asherman is the possibility. For cervix, if it is appearing soft, uniform strain, then favorable for embryo transfer. But if it is appearing stiff internal loss, then it may hinder embryo transfer. Testis, if it is appearing uniform elasticity, then it is normal. But if there is a focal stiffness is there, then there can be a varicocele, fibrosis, or decreased spermatogenic potential. What are the advantages of it? Advantages are it is non-invasive, it is safe to use, and definitely repeatable. It provides the quantitative tissue characterization and it enhances the reproductive diagnostics without exposure to the radiation. Its limitations are it is operator dependent, especially strain elastography, because that compression force that operator only has to provide. It requires training and advanced ultrasound systems. It is limited normative data is there for fertility specific applications. What are the future directions? We can combine this elastography with 3D ultrasound and Doppler imaging in the future. We can develop standardized protocols to do it, and we can expand our clinical research in fertility outcomes. So, conclusion is ultrasound elastography provides relative and quantitative assessment of tissue stiffness. It is a promising tool in infertility assessment. It adds valuable objective data to the traditional imaging, and future integration can optimize the reproductive care pathways. These are my references. Thank you.